What if the exhaustion you've been writing off as just getting older isn't about age at all? What if the blurry vision, the restless nights, the tingling in your feet, what if those weren't random inconveniences, but your body sending you a very specific message in the only language it knows? Here's what most people over 60 don't realize. High blood sugar almost never announces itself loudly. It doesn't come with alarms or obvious symptoms, at least not at first. It whispers. And by the time most people hear it, years of quiet damage have already been done. Today, I want to make sure you can hear what your body is trying to tell you. After the age of 60, something shifts in the way your body handles glucose, the sugar that fuels every single cell you have. Your pancreas, which has been faithfully producing insulin for decades, begins to slow down. Your muscle cells, which are your body's primary glucose disposal system, become less sensitive to insulin's signal. And the result is that sugar that should be clearing from your bloodstream stays there longer than it should, doing damage that is slow, invisible, and cumulative. Here's what a healthy body does in the hours after a meal. It releases insulin, shuttles glucose into the muscles and liver, powers the brain, and returns blood sugar to a stable baseline within about 2 hours. That system runs in the background of your life like a quiet, well-managed power grid. But here's the problem. After 65, that grid starts flickering. The response is slower. The cells stop listening as well, and glucose lingers in the blood, not at levels that immediately trigger a diabetes diagnosis, but at levels that are high enough to quietly inflame blood vessel walls, damage nerve fibers, cloud the lenses of the eyes, and exhaust organs that are trying to compensate. This is not random. This is physiological, and it is happening in millions of people right now who have no idea because the signs are silent. Blood sugar dysregulation, the kind that precedes a diagnosis or exists quietly alongside one, is not a switch that flips. It is a slow drift, and your body, being the remarkable system that it is, compensates for as long as it can. Think of it like a ship taking on water through a very small hole. For a long time, the pump keeps up. You don't notice anything, but the pump is working harder than it should, and eventually the signs start appearing, not as emergencies, but as whispers. Today, I want to walk you through the 7 most common silent signs that blood sugar may be running too high. Signs that are frequently dismissed as normal aging, stress, or just the way things are now. This is not about fear. This is about knowledge. Because the earlier you recognize these patterns, the more time you have to act, and the more reversible the situation becomes. Let's begin. Before we dive into the countdown, I want to ask you something personally. Drop a comment below. How old are you, and what health concern keeps you up at night? I read every comment on this channel, and your answers genuinely guide what I cover next. It only takes 30 seconds, and it matters more than you know. Today, we're counting down 7 silent signs from concerning to absolutely critical, each one building on the last. And by the time we reach number 1, I think you understand why I call elevated blood sugar the quiet thief of healthy aging. Coming in at number 7, and this one catches almost everyone off guard, the kind of fatigue that sleep doesn't fix. You go to bed tired, you sleep 8 hours, you wake up tired, and by 2 in the afternoon, you feel like you need to lie down again. Most people blame this on age, on stress, on just not being 20 anymore. But here's what's actually happening at the cellular level. When blood sugar is chronically elevated, your cells struggle to absorb glucose efficiently, which means they are, in a very real sense, starving for fuel even when your bloodstream is swimming in it. It is like being surrounded by food you cannot eat. Your body reads this as an energy emergency and responds with fatigue, a deep systemic exhaustion that no amount of rest resolves, because the root problem isn't sleep, it's fuel delivery. Researchers at the University of Chicago published findings in the journal Diabetes Care showing that adults with elevated fasting blood glucose reported significantly higher rates of persistent fatigue compared to those with normal glucose levels, even when total sleep time was identical. For someone in their 60s or 70s, That is not a minor inconvenience. That is years of life experienced through a fog. Here is why this matters more as you age. After 65, your mitochondria, the energy factories inside each cell, become less efficient on their own. Add impaired glucose uptake to that equation, and you have a double burden on your energy system that explains why so many older adults describe feeling tired at a level that just doesn't make sense. The practical signal to watch for: fatigue that is worst in the morning and after meals, rather than improving as the day goes on. If you feel more depleted after eating than before, that is your body struggling to manage a glucose surge. And speaking of surges, what I'm about to tell you next, sign number 6, is something that affects almost every older adult I've seen in practice, and almost none of them connected to blood sugar. Do not go anywhere. At number 6, a sign so common in older adults that most people have stopped questioning it entirely. Getting up to use the bathroom once or twice at night is something millions of people over 60 simply accept as part of aging. And while there are other causes, prostate issues, bladder changes, certain medications, one of the most overlooked drivers of nighttime urination is elevated blood sugar. Here's the mechanism. When blood glucose rises above a certain threshold, your kidneys, which normally recapture glucose and return it to the bloodstream, become overwhelmed. They can't keep up, and so they begin excreting that excess glucose through your urine. To do that, they need water. So your body pulls fluid, produces more urine than normal, and your bladder fills faster than it should. At night, when you should be in deep restorative sleep, you're up 3 times instead. A study from the Journal of the American Geriatric Society found that nocturia, nighttime urination, occurring 2 or more times, was significantly associated with undiagnosed prediabetes in adults over 65. For someone in their 70s, that is the difference between restorative sleep and fragmented rest that accelerates cognitive decline, raises cortisol, and impairs immune function. The pattern to notice is this. If your nighttime urination has increased gradually over months or years, and if it's accompanied by increased thirst during the day, which we'll talk about in a moment, that combination is worth mentioning to your doctor explicitly, because individually each symptom gets dismissed. Together, they paint a picture. And speaking of what you can't see, sign number 5 is the one I tell every patient they absolutely cannot afford to ignore. And I mean that specifically. Do not go anywhere. Number 5, this is the one. You reach for a book and the words seem slightly soft. You look at your phone and have to squint. An hour later, it's fine again. Most people blame it on their glasses prescription, on eye strain, on needing more light, and they wait. Sometimes they wait for years. Here is what is actually happening. The lens of your eye, the structure that focuses light, is exquisitely sensitive to changes in fluid balance. When blood sugar rises, it draws fluid into the lens through osmosis, causing it to swell slightly and change shape. That shape change alters how light bends through it, and the result is temporary blurring. When blood sugar drops back down, the fluid shifts out, the lens returns to its normal shape, and your vision clears until the next glucose surge. This is not a vision problem. This is a blood sugar problem that is expressing itself through your vision. A 2019 analysis in ophthalmology found that intermittent blurry vision was one of the earliest reported symptoms in patients later diagnosed with type 2 diabetes, and that the average gap between first noticing the symptom and receiving a diagnosis was over 3 years. 3 years of unchecked elevated glucose, silently damaging the tiny capillaries behind the retina that once gone, do not grow back. I want to be direct with you. Fluctuating blurry vision that is not explained by a stable prescription change is a symptom that warrants a blood sugar check. Not someday, soon. After 65, the stakes are higher because the compensatory mechanisms in retinal circulation are weaker. The margin for error is smaller, and the damage, if it goes long enough, becomes permanent. This is also where I want to share the story of a patient I'll call Margaret, 71 years old, from Tucson. She came to see me after 2 years of what she described as her eyes just getting old. Her optometrist had updated her prescription twice. She bought 3 pairs of reading glasses. The blurring kept coming and going. When we ran a standard blood panel, her fasting glucose came back at 118, squarely in pre-diabetic range. Her A1C, the 3-month average, was 6.1%. We worked together on dietary changes, a walking routine, and a few targeted additions to her daily habits. 6 months later, her A1C was 5.6%, and she told me, I still remember exactly what she said. I feel like someone cleaned the windows. That is what early recognition can do. Sign number 4, coming up next, is one that I believe is responsible for more unnecessary suffering in older adults than almost any other silent symptom. And it's something almost everyone assumes is just normal aging. Don't move. Number 4, and this one is more serious than most people realize. You nick yourself in the kitchen. A small cut, nothing dramatic. But 2 weeks later, it's still red around the edges, slightly swollen, not quite healed. Or you get a urinary tract infection. You treat it, and it comes back. Or a small skin irritation becomes something that won't quite resolve. Slow healing is one of the most underappreciated consequences of chronically elevated blood sugar, and it operates through multiple pathways simultaneously. First, high glucose impairs the function of your white blood cells, the immune soldiers that respond to injury and infection. It literally makes them less mobile and less lethal. Second, elevated blood sugar damages the small blood vessels that carry oxygen and nutrients to the skin and peripheral tissues. Without adequate circulation, healing slows to a crawl. Third, glucose is a food source for bacteria and fungi, meaning that any break in the skin becomes a more hospitable environment for infection when blood sugar is high. Research published in Wound Repair and Regeneration found that adults with impaired glucose metabolism showed healing rates significantly slower than normoglycemic controls, and that this difference was measurable even in the pre-diabetic range, not just in diagnosed diabetes. After 70, this matters enormously. Circulation to the extremities is already reduced. Immune response is already slower. Adding impaired glucose metabolism to that equation creates a triple vulnerability that makes even minor wounds a serious concern. Watch for this pattern. Wounds that take more than 2 to 3 weeks to fully close, or infections, especially skin, urinary, or yeast infections, that recur within weeks of being treated. These are not coincidences. Right here, before we go further, if this is opening your eyes, if you're starting to see patterns in your own health that you hadn't connected before, please hit the like button and subscribe if you haven't already. We publish new videos every week, all focused on the science of healthy aging for people just like you. It takes 1 second, and it helps us reach more people who need this information. Thank you. Number 3, and this one is about your nervous system. A tingling in the feet when you wake up. A strange numbness in your fingertips that comes and goes. Occasional sensations like your foot has fallen asleep, even though you haven't been sitting in an unusual position. These sensations have a medical name, peripheral neuropathy. And elevated blood sugar is one of the leading causes. Here is the biology. Your peripheral nerves, the ones that run to your hands, feet, and legs, are wrapped in a protective coating called myelin. Think of it like the insulation on an electrical wire. When blood sugar is elevated for extended periods, a process called glycation occurs. Glucose molecules attach themselves to proteins, including the proteins in nerve tissue and blood vessel walls. This degrades the myelin sheath, disrupts nerve signal transmission, and reduces the blood supply to the nerve itself. The result is those strange sensory distortions, tingling, burning, numbness, or the sensation of walking on sand, even on a smooth floor. A landmark study from the New England Journal of Medicine followed adults with prediabetes over 4 years and found that peripheral neuropathy was already measurable in a significant proportion of them before they had ever received a diabetes diagnosis. For someone in their 60s or 70s, that is a warning delivered years before the formal label arrives. Why does this matter so urgently with age? Because peripheral sensation is foundational to balance. When you lose accurate feedback from your feet, your stability is compromised, and falls in older adults are among the leading causes of hospitalization, loss of independence, and premature death. This is not a peripheral issue. It is a central one. I think of one patient, Robert, 68, from Nashville, who came in for what he called clumsy feet. He tripped twice in 3 months. He thought it was his shoes. When we tested him, his blood sugar pattern told a different story. With early intervention, he told me 6 months later, I feel the ground again. I didn't realize how long I'd been walking on clouds. And now, number 2. This one involves your heart. And the findings, when I first reviewed them, changed the way I counsel every patient over 60. Do not go anywhere. Number 2, and I want you to take this one seriously. Occasional awareness of your own heartbeat. A fluttering sensation in the chest. A tightness that comes and goes, not dramatic enough to seem like an emergency, but persistent enough to be noticed. Most people attribute this to anxiety, caffeine, or just stress, and sometimes it is. But chronically elevated blood sugar is a direct cardiovascular stressor, and the heart feels it. Here's the mechanism. High glucose triggers a state of low-grade systemic inflammation. Think of it as a slow, invisible fire burning throughout your circulatory system. Over time, this inflames the walls of blood vessels, makes them stiffer, and promotes the buildup of arterial plaque. It also disrupts the autonomic nervous system, the part of your nervous system that regulates heart rhythm without your conscious input, leading to subtle arrhythmias and rhythm irregularities. The Framingham Heart Study, one of the longest-running cardiovascular studies in medical history, established that elevated blood glucose is an independent risk factor for atrial fibrillation, even in people without a formal diabetes diagnosis. For a 70-year-old, that is a finding with profound implications for stroke risk, quality of life, and cardiovascular longevity. Here's what I explain to every patient I see with unexplained palpitations. The heart and the pancreas are in constant conversation. When one struggles, the other bears the cost. After 65, that cost compounds rapidly. The pattern to watch for? Palpitations or chest awareness that correlates with meals, especially high carbohydrate meals, or that is accompanied by excessive thirst, fatigue, or any of the other signs we've already discussed. Individually, any one of these is easy to rationalize. Together, they are a message. And now, number 1. I want you to brace yourself, because this is the sign that when I first reviewed the emerging research, made me stop, set down the journal, and say out loud, why is nobody talking about this? Number 1, the most silent, the most consequential, and the least discussed. You walk into a room and cannot remember why. You lose a word mid-sentence, a word you've used 1,000 times. Your thinking feels slower than it used to, less sharp. And the fear that follows that observation is one of the most profound fears a person over 60 can carry. Is this the beginning of something irreversible? Here's what the science is now telling us with increasing certainty. The brain is the most glucose-dependent organ in your body. It accounts for roughly 20% of your total energy consumption, despite being only 2% of your body weight. And like the muscles in the liver, the aging brain becomes progressively less efficient at using insulin to absorb that glucose. Researchers have begun calling Alzheimer's disease, in some forms, type 3 diabetes. That phrase is controversial, but the underlying observation is not. Impaired glucose metabolism in the brain is directly associated with the accumulation of amyloid plaques and tau tangles, the structural hallmarks of cognitive decline. A study published in Neurology, the Journal of the American Academy of Neurology, followed more than 2,000 adults over a decade, and found that those with elevated blood sugar, even in the pre-diabetic range, showed measurably faster rates of cognitive decline and greater hippocampal shrinkage than those with normal glucose levels. The hippocampus is your brain's memory center, and it is exquisitely sensitive to metabolic disruption. For someone in their 60s or 70s, that research is not abstract. That is a biological window, a period when intervention still has the power to alter trajectory. Here is the extraordinary part. Multiple studies now show that stabilizing blood sugar through dietary modification, regular physical activity, and targeted sleep optimization can slow or even partially reverse early cognitive changes. This is not a story of inevitable decline. This is a story of metabolic leverage, and you have more of it than you've been told. I think of Eleanor, 74, from Portland. She came to me convinced she was in the early stages of dementia. She was terrified. She couldn't finish sentences. She kept forgetting appointments. Her fasting glucose was 124. Her A1C was 6.3%. We spent 12 weeks working on blood sugar stabilization together. At her follow-up visit, she sat across from me and said, "I got my mind back. I thought it was gone." Eleanor's story is not rare. It is underreported. Let me bring this full circle. The 7 silent signs your blood sugar may be running too high. Persistent fatigue that sleep doesn't resolve. Frequent nighttime urination paired with excessive thirst. Vision that blurs and clears with no consistent explanation. Wounds and infections that are slow to heal. Tingling or numbness in the hands and feet. Unexplained heart palpitations or chest awareness. And finally, the one I urge you never to dismiss, brain fog, word loss, and cognitive changes that feel like something's shifting beneath the surface of who you are. None of these are inevitable. None of them are sentences. The protocol is simpler than you might expect. A fasting blood glucose test and an A1C from your doctor. 2 numbers that together give you a clear picture of where you stand. Combined with whole food eating that minimizes glucose spikes, 30 minutes of walking most days, 7 to 8 hours of sleep prioritized as medicine, and a conversation with your physician about your specific numbers. That is the entire framework. No dramatic overhaul, no expensive intervention, just information and then action. I have spent over 3 decades watching people in their 60s, 70s, and 80s transform their metabolic health, and with it, their energy, their memory, their vision, their balance, their independence. The ability to drive yourself to an appointment, to finish a conversation without losing the thread, to walk on solid ground and feel every step. These are not small things. These are the architecture of a life. Your body has been speaking to you. Now you know the language. Every transformation begins with a decision. A decision to stop accepting these signs as inevitable and to start asking what they actually mean. Get your numbers. Talk to your doctor. And do not ignore number 5. I'll see you in the next one.